Hello and welcome all to the second day of APAC HealthTech Innovation Conclave. Welcome all the esteemed speakers in the very first session of second day designation. Yesterday, we saw presence of eminent healthcare leaders from the industry, from academia,
Souvik ji,
and
can you
throughout the
hear
day,
me?
can you hear me?
Yeah,
Yeah, because I just found that someone is taking my name. So yeah, so as I was saying that yesterday we had the presence of healthcare policy leaders, healthcare leaders from hospitals and as well as from healthcare tech industry. And throughout the day we discuss on various aspects of health tech per se, and how we can make a comprehensive health tech ecosystem to take things forward, especially in the new world. And today, in the opening session of day two, a very important subject will be discussed because when we talk about health tech, we talk about data, and securing that data is of utmost importance. The name of this session is Ensuring Cybersecurity in Evolving Digital Healthcare World. For that, we have leaders of healthcare fraternity with us who have joined us. Let me first introduce to all of you Mr. Aloke Vaidya, Regional Pre-Sales Lead Commercial Segment, VMware India. Welcome, Mr. Aloke. Thanks for joining us.
Thank you. It's a privilege to be part of this panel.
We're also joined by Mr. Shirish, Contractor, Manager IT, KD Hospital. We welcome Mr. Shirish. Thanks for joining us.
Thank you for providing me an opportunity.
We're also joined by Mr. Manish Pathak, Head IT and Automation, Sahara Hospitals. We welcome Mr. Manish. Thanks for joining us. We're also joined by Mr. Kishor Gojiya, Head IT, CIMS Hospital Private Limited.
thank you all. Thanks for this privilege. Thank you.
We're also joined by Mr. Bitopan Sarma, Head IT and Business Process, Excelcare Hospitals, Guwahati. Thank you so much for joining us, Mr. Bitopan.
Thank you. Thank you so much for providing me the opportunity to sit with the esteemed panelist. Thank you.
In this session, we will be discussing along three central points. One is managing and securing data, moving towards cloud deployment, and building a robust and secure digital infrastructure. With this, let me first put the first question to Mr. Aloke Vaidya from VMware India. Mr. Vaidya, my question to you would be that with applications moving to cloud, even users of this application moving out to different locations, and we have seen the same during the pandemic. As a technology provider, how do you address the new evolving need of combining cloud networking with cloud security? Because you know there are a lot of apprehensions on cloud security. So your take on that, Mr. Aloke. Over to you.
Correct. Thanks, Souvik. I think, yes, you're absolutely right. When you say that in the current times, we are seeing a very rapid movement towards cloud infra, and primarily because of the current situation, which is like, sudden need of expansion, and that has been the primarily driver, I would say, for adoption of cloud. And we have seen that happening so, gradually, and, it has been so fast. Now, obviously, what we are also seeing is that end users of these applications are also moving out and distributed because a lot of organizations, many functions, they were forced to start working from home. So, to prepare for the new normal, so what we are gradually seeing is a need to rethink how how would people access, from where would they access, and so on. So we are seeing a great adoption of newer technologies like SD-WAN, and this, when we talk of SD-WAN, and same is evolving into what we call as a secure access service edge, or a SASE platform, to combine cloud networking and cloud security, and to provide this operational efficiency and optimal application experience. So what is essentially happening is, and what as technology provider, what definitely we are seeing is, how do we combine this SD-WAN technology with a secure access, the new concept of a zero trust network access solutions, with something like a secure web gateway, cloud security, and you mentioned about that, cloud security access or a CASB solution, web application firewall, or a next generation firewall functionality, all delivered through, or different point of presence, or pops. So these networking and security services definitely can be delivered in an intrinsic or in a sequence manner to wherever people are coming in from. So whether it is at remote locations where possibly a pop-up hospital would have been brought up, or even if it's a mobile user, and for that extent IoT device. So we are definitely seeing a lot of adoption happening, and definitely a thought process around how do I secure the edge from where these people are connecting to these applications.
Right, right. Interesting take by Mr. Aloke. I'll come back to Mr. Aloke. Mr. Shirish, your take on the moving towards the cloud deployment for hospital digital infrastructure. Your take on that, please.
Yeah. So there are actually basically four steps involved if you want to move your application to cloud. One is the strategy, in which you will perform a with analysis of the application which you want to move to cloud. And that will conduct. You need conduct actually workshop, understand the application, analyzing the data that is
Is there
collected.
any network issue with Mr. Shirish, or some I'm only
No,
facing
no,
that problem? I don't know.
no. It is fine. My network is fine.
There's a little bit of
Am I audible?
audio is a
Am I
little bit of
audible?
distorted.
Hi, Mr. Shirish. Can you
Yeah,
hear
I
us?
can hear you. Yeah.
Yes,
Am I
audible now.
audible
Yeah.
now?
Yeah.
Yeah.
Okay.
So
Yeah, yeah.
basically, there are four steps if we want to move our applications to the cloud. First is the strategy in which you will collect the data about the application which we want to migrate to the cloud. Conducting that, analyzing the data to what you will gain and what will be the pain point for you. That is also one part of the strategy. And you need to make sure that the long-term gain is attained by migrating the applications to cloud. Second is analysis and planning. So high-level design of migration, which involves analysis and planning activities. So artifacts, applications that, that are about to be migrated to cloud are reviewed. So any constraint associated in the migration will be reviewed as a part of the analysis. A migration where minor changes are required in the applications or not. Then transformation where business logic changes are required to take advantage of the cloud environment. And in some cases, it may be required to rebuild the application or rewrite the application. An estimate of the time also required that how much time it will take to completely migrate the applications to the cloud. So the key activity is that cost benefit analysis of the migration. Second is detailed migration plan, and third is associated schedule. So you can plan accordingly. Third is the design. So development and integration. It involves development and integration. After the applications are analyzed and classified, the next step is to perform these applications which fall in the which class. The design, development, and integration activities are different. The key output of the step includes that architectural article, design document, project plan, and test and deployment plans. Four is the migration development. The development applications that have been identified for cloud enablement. The analysis performed as part of migration framework will indicate appropriate deployment model for the application, including private cloud, managed private cloud, hosted private cloud, or a public cloud. During the architecture analysis planning phase, it is important to identify the application which will be which model you are going for. Infrastructure as a service, platform as a service, or a software as a service to take advantage of the cloud service already available. So these are the basic four plans which we will take an account while migrating to the cloud. Hello.
Right, right. I'll come back to Mr. Shirish Contractor again. Let's have a perspective from Mr. Manish Pathak, Head IT and Automation, Sahara Hospitals. Mr. Manish, your take on moving towards the cloud deployment when you're talking about uh, the evolving digital healthcare world, especially keeping in mind the aspect of cybersecurity. Your take on that.
Absolutely. Thank you so much for inviting me for this great session, and welcome all of you have joined here. Uh, that's a great sound, and absolutely the India is striving in a digital healthcare transformation. Absolutely correct. Patient generating more data day by day. Uh, we are managing huge data in hospital, in segment of patient record, in segment X-ray, in such a form of treatment, clinical data. We have a lot of data in our hospital, even MRD department, maintaining a lot of data in the hospital. So normally what we basically we feel that in hospital, what is the most important part is that the securing a data of the patient. And how we are securing, we have a basically a in-house our data center established in our hospital. We have several things that we are maintaining, even to secure patient data, to secure infrastructure, to secure our environment. And how we are processing, we are managing basically with the conventional approach. Truly speaking, we are managing with the conventional approach, cloud storage. We haven't moved on cloud infrastructure. So currently how we are managing our database, even our data of the patient with firewall protection, to provide a secured connectivity to our users. Even we are maintaining a limited network access, maintaining good computer habits, establishing a security culture. See, these all are we are handling with absolutely with a simple and easy task, with a simple way. But it's not a easy to handle a security, cyber security prospect on a cloud based storage. Absolutely, day by day more technology introduces, more security is concerned in terms of healthcare security. So how we can move and how we can just secure our infrastructure, it's a very challenging for us. So definitely we are contributing to secure our data, secure our health policies, secure our infrastructure. But somewhere we are also in a threat. We are also in a very different different and difficult time. When we talk about the COVID, especially COVID time, malicious attacks, malware attacks, even we have faced several uh, uh, phishing, spam mails. So we are managing through our definitely simple policy. But somewhere around, what I feel, in future we will have to just move on more cyber security, and we will have to just focus on more but secure things and secure environment. Thank you so much.
Moving on to secure environment, maybe with cloud deployment, that was the crux of what Mr. Manish has said. We'll come back to Mr. Manish as well with the second set of questions, but let's have a perspective from Mr. Kishor Gojiya, Head IT, CIMS Hospital Limited. Mr. Kishor, your take on this particular topic on moving towards the cloud deployment when we are talking about ensuring cybersecurity.
Especially if I share healthcare nowadays adopting a lot many of technology. Before a couple of year ago, healthcare are not focusing on adopting a technology, because nowadays, due to so many of current situation, pandemic, healthcare service provider are aware that the technology is the only way where they can reach to the patient by using the different things like the telemedicine and the all this setup. So considering all these things, most of the Indian scenario, hospital have a legacy local in-house data center which they are managing. and somehow the healthcare are not so techno savvy, though they are not giving a good budget to set up the data center which can be expand on the next level. So due to that limitation, to implement and to host new application, the healthcare service provider are adopting a cloud technology, because the new technology are required resource hungry, they require more bandwidth, and to set up everything it's required a huge capex cost. To overcome this capex cost, healthcare has adopted cloud technology. Yes, of course, there are security major concern are still there, but the tool are available, the security are available, the cloud deployment is easy, the service provider are available. So it is very easy to deploy on cloud, to extend on cloud, and to host the application with the appropriate way wherein patient and the client can easily access all these infra as well as the application. So cloud adoption is easy nowadays, and healthcare service provider are very much keen to adopt it. Why? Because they don't want to invest on capex. So on a opex based model, they are going move forward for the cloud deployment. Thank you.
Interesting, interesting. Mr. Bitopan, your take on this particular topic.
Yeah, thank you so much. Thank you so much for the opportunity. Uh, Mr. Kishor and Mr. Manish has already lighted on how healthcare and how a hospital industry is operating currently. Mr. Manish has rightly said that we are still in a primitive type of operations where we are still having a data center. We are having a dear strategy, and having a dear location is a levis for any hospital organizations. For having a cloud is uh, uh, and I think it is still as an options for the healthcare industry. We are all having in-house data center. We are somewhere maintaining our disaster recovery strategy in cloud computing. But yes, in near future, we think, and I think we have to move to cloud operations, because lot of devices are coming to this industry. Lot of health tech, because we are talking about ensuring cyber security of health tech devices. So we have to be very much agile. So to be agile, I think we have to be connected, and we have to have accept the cloud deployment in some way. Now, coming to the point of moving to the cloud, uh, as Mr. Kishore has rightly said that we are having a very limited budgets for the technology departments in most of the hospitals. We are facing it. I think I am comparatively new to this industry comparing to the eminent leaders in the panelists, but I had worked in different domain companies, but I have seen that healthcare industry is in India specifically still a bit lagging behind to adopting and implementing technology and in their day-to-day operation. So cloud deployment definitely will boost will definitely going to boost our future health tech industries, because it gives you the agility, it gives you on-demand services wherever you need it. It gives you the inter, because most of the devices, most of the applications are nowadays coming with cloud ready type of applications. So definitely the future is cloud deployment, but I think to have a seamless operations through cloud, the basic infrastructure needs to be developed initially. Like the seamless network connectivity is the need of the hour. Because I am saying from one of the remotest part of the India, that is in Guwahati, we are still struggling to have a seamless network connectivity here. If I put my applications on cloud, so I cannot afford to have a single minute of downtime in the business operations. So I have to ensure that the criticality of the business operation should not hampered. Just for the sake of moving to cloud is not its current option for us, because we have to make sure that infrastructure also support us. Cloud gives us enormous opportunity to expand. So definitely, I think all the stakeholders, all leaders, not only IT leaders, the business leaders, policymakers, will come to one point that yes, this tool, this platform can give us the benefit. So I think in coming days, and I must say that in post-COVID, we really got a chance to do things in a better way. At least technology in healthcare has been appreciated and has been adopted, and that yes, technology can boost the entire process of healthcare delivery. Thank you so much.
Right, right, Mr. Bitopan. Yesterday in the inaugural, the DG NIC, Dr. Nita Verma, also talked about. Let me just share with you, all of you, that yesterday when we were having discussion in the inaugural, most of the speakers, be it from government, be it from industry, be it from the hospital ecosystem, they all talked about the cost-effective deployment of technology and also sustainable aspect of using technology and reaching out to the last mile. As Mr. Ritopan was saying that he comes from Guwahati and more the remotest area in Assam, how to engage or deploy technology. I think cloud can be an answer to that. Obviously, budgeting all has to be looked at. Yesterday, we had a panel with hospital CIOs. They're also they talked about that. It was a 1.5 hour session. The crux was that we have to invest in technology anyhow, because
Right,
that is the way forward. We don't have any other option. Otherwise, we all become redundant. We don't use technology, so we have to keep in that mind. So, hospital owners who are running the hospital, who are in the business of running the hospital, they have to take into this consideration. We'll come to that. Mr. Bitovan talked about devices devices also when before the cloud deployment thing. Let me come to Mr. Aloke. Mr. Aloke, we are seeing huge proliferation of devices in this space as well. And but how to manage those devices? Your thoughts on that?
Absolutely, and I think it's an interesting aspect, and this is what, while everybody definitely agreed that cloud adoption is gradually happening, and there are so many things happening across the globe around adoption of technology for better healthcare services. So, and in this aspect, definitely we are seeing that huge amount of, as you rightly said, Shobik, proliferation of different kind of devices in this space, right? So as the technology provider, right? So we believe in one principle: how do we improve patient outcome and empower the team, so which is the care team or the staff? So that is to deliver secure, uh, simple access to patient information on what we call as the right device, the right do for the right task and the right time. Now there are a couple of key elements on this whole thing, right? And this has to be taken care of. First of all, foremost, and I think everyone really spoke about it: how do I empower and scale a secure distributed healthcare workforce? Because at this point of time, we have seen there are needs of clinician data to be available 24 cross 7 from possibly even remote locations, if even pop-up hospitals, makeshift arrangements, and so on. So how do we support clinician and staff flexibility? How do I enable secure remote access to healthcare system and PHI from any device or any location? That's the first things when we really talk about that. How do I manage the device? So essentially what I'm saying here is, how do I make sure that whatever devices are being used, right? Today it could be a corporate device, it could be a bring your own device, but I should be able to have controlled access to whatever specific information I need and accessible at any place. The second aspect is the experience, because ultimately the adoption of technology is directly related to the experience of whoever is using that technology. So how do I drive patient engagement through delivery of diagnosis or prognosis and treatment option information, and helping to reduce those hospital readmission? Because that's the primary objective, because continuity of care is objective, continuity of availability of data is something which we need to look at. The third aspect I feel is, how do I ensure business continuity and resilience? And I think everybody really spoke about that. So how do I deliver on operational continuity and disaster preparedness goals by ensuring high availability and access to critical resources from any device or any location, and like I said, even at those pop-up hospitals? Now in this kind of situation, what we are also seeing, and this is the new age technology adoption which we are seeing, fortunately or unfortunately because of the situation, we're seeing a lot of those devices getting adopted now. So particularly things around AR or augmented reality or mixed reality, or even those head mounted displays which have been growing rapidly, and this is happening across the globe. Now, to address this specific growing market and subsequent IT challenges associated with deploying such endpoints, what we are doing as as a technology provider, as VMware, what we are doing is we are partnering with leading healthcare software vendors as well as the hardware vendors to make sure that these are manageable, as well as made sure that there is enough of security components inbuilt into the system, so that not only I can deliver those applications securely to those devices, whether it's an Android device, whether it's a Windows 10 device, whether it's a wearable device, those kind of things, I should be able to manage it and make sure that only those data points are made open, which makes the person productive. Yeah.
Right, right. I'll put a question to other speakers, but I just want to have an interaction because what Mr. Bitopan has said. So, if I may ask, Alok, as a company, as a VMware, how can you address the challenges faced by Bitopan, who is sitting in Guwahati and he's working in a very remote area? How do you
Yeah.
address the challenge of the technology for a hospital like Excelcare Hospital?
Correct.
Quickly.
So yeah, so surely I'll just try to keep it short. So yes, I think while one aspect of bringing agility, and I think Tuman spoke about that, is how can I adopt newer technologies. Bringing agility also means that if I'm able to scale based on the needs of my agility, and definitely bring in aspects of network, because without network, as he rightly said, without network, obviously everything falls flat. If I have to give access to certain applications, whether it is within my campus, within the premises of the hospital, or whether it is in a pop-up hospital, or in even those OPD centers, network connectivity becomes a key challenge. And that's where technologies like SD-WAN and SASE, which I spoke initially, like secure access service edge, which makes sure that not only can I combine multiple network points, let's say multiple internet links, put in a dongle, still I am able to balance together the network, and still bring in the security aspects elements to it. All these combined together could be a strategy to drive how do I make sure that I start adopting the newer technologies. And the other element is on the data center side, right? So how do I make sure that I am able to scale without disrupting anything in my local network? So how am I able to shift workloads without possibly having any downtime seamlessly to cloud if I need to? And then even if my work is done, if there is no need to continue on the cloud, can I bring it back? Because those are the elements which would make sure that I have a complete agile infrastructure.
Right, right. If I may come to Mr. Shirish, Contractor. Mr. Shirish, you're managing IT in a hospital. So,
Yeah.
when you talk about securing the cyberspace, when you're talking about the securing the data, what are the challenges do you face as a person who's managing the entire digital aspect of a hospital? What are the challenges you're facing? I'll ask the same question to other panelists as well, but let's start with Mr. Shirish.
So basically, if the ports are not configured properly, that will attract hackers to access your data or disrupt your workload. Then in the infrastructure as a service model, there is not much very lack of visibility to the end user. I mean customer. So they are not aware of the exact what is going on the provider's space side. Then there are very much change in the workloads also. So traditional security tools are not capable to meet the need or enforcing the protection and policies to the cloud. Yeah.
I think there's some network issues with Mr. Shirish. Mr. Shirish, you can just quickly check in again because I think your voice is breaking the middle. So we'll come back to Mr. Manish. Your thoughts on that as a person who's managing the IT and automation in Sahara hospitals. What are the challenges you face when we talk about resilient cybersecurity infrastructure, building that kind of resilience?
See, in Sahara Hospital, basically we have an ERP system, Windows-based ERP system, basically. And for patient convenient and for patient point of view, what we have done, we have just implemented few of things through digital platform. We have implemented online appointment, we have implemented a payment gateway, we have implemented a lab online reporting system. So several application basically integrated with our website, as well as several things we are running on the you know web portal. So see, when we are talking about the moving towards cloud infrastructure, the main challenges we basically as a IT had, what kind of challenges we are normally facing these days, to convince to higher management and to convince for the budget for upgrading our infrastructure and to moving on a cloud infrastructure. See, we have invested a lot of amount on a data center. We have a lot of capex involved on hardware. So beside of that, we cannot throw all the system, we cannot even throw outdated devices until and unless it is not it is not completely non-repairable in a condition. So see, the challenges, what kind of challenges we are currently facing, somewhere around, it is very difficult to us to convince management for a cloud moving infrastructure. Even if they are asking how it's going to help in our business transformation, absolutely we have to provide a certain ROI on that. And we understand about that IT never generate any kind of ROI. IT always help us in a process, in a to improve quality, to improve clinical information, keeping the data in a secure environment. These kind of things always comes in a mind when management takes any decision on the cloud, moving a cloud infrastructure, and they ask how you are going to protect our data on a cloud. Even we provide certain things to the management that cloud infrastructure is very secure currently, and it is very secure from in a point of view of failure system, in a point of any kind of any attacks, any type of definitely any type of difficulty when we came down to understand about the in premises data center. So we give a lot of freedom to the management, but we fail every time to convince authority to moving towards a advanced technology in healthcare IT. But gradually we are moving on a little bit part of on a web portal level on cloud system. And we feel that in future, after 2 or 3 years, in future, definitely management will understand about the importance of cloud and importance of a digital transformation. And we will be able to move our complete infrastructure towards cloud infrastructure.
Mr. Kishore, your thoughts on the challenges you might face or you're facing when it comes to securing the cyber space for the operations of a hospital?
uh, Healthcare industry is driven by doctors. So the first challenge which we always have, that doctor want everything on their hand, and they don't want any control on their access. So they want full control, they want full access, they want to access any of the website. They don't want to change their password, they don't want to keep their password very securely. So they set their password, which can be easily break. So for any application, to secure the application layer, there are few things which required to follow by the user, like application access control, application rights and role based control. So all are these things required to maintain, and as an IT head, we should have to control all these things. But on the other side, we have a user who are the owners, who are the in charge of the process, who are the key revenue generators, wherein we cannot force them to follow the IT policy and structure. So we have only one option to educate them. By educating them, we have to ask them to use the our application with the secure manners. So that is one of the key major challenge, wherein our most of the user are not so techno savvy. They need so much of open access, and considering this, it is a major challenge for the IT guy to control the environment in the open access area. And the second challenge is, Mr. Manish rightly said, that there are so many applications are available in the premise. While we integrate one application with the other application, we need to create a bridge. And if we compromise to breach security while we are integrating the both the application, there may a chance of hack the application. So it is very much important to bridge two application internally, because there are so many applications installed in the premise, and if we didn't integrate with each other, the data will be a mess. User has to access multiple application, they have to do the data duplication, they have to do the data entry on a various platform. So integration is must. So while we talk about integration, always risk will be associated with the integration. So if the integration layer are not so secure, there will be a chance to hack the application, to lose the data, and to compromise on our infrastructure. So the another challenge is the integration part. And the third most important, there are, yes, of course, we all are aware, there are so many security tools are available. But of course, considering a cost effectiveness solution, as Mr. Manish rightly said, we are not a revenue generator department. So we have to settle down, we have to implement, we have to adopt the technology who is cost optimization and the with the less investment. Considering all these aspects, we have to choose a technology which give a result with the very minimum cost effective things. So say example, we know healthcare required to secure all this data, but there are so many less hospital are available in the days, those who have invested on a DLP, because DLP itself, it is requiring a huge cost investment on the licensing part and the infrastructure part and all. So the third most important and the major challenge is the tools adoption, the costlier tool adoption in the healthcare. Yep. Thank you. Souvik ji, you
Shovik,
are
you are
mute.
on mute. Shovik, you're talking on mute.
Souvik ji, you are mute.
Yeah,
Yep.
yeah. I think that's the problem of using technology. So all time you have to be aware that you have to unmute and mute your mic. So it's part and parcel of that. So let me have a perspective from Mr. Bitopan. Bitopan, your thoughts on the challenges which you're facing, and those challenges. How can we overcome those challenges in terms of ensuring cybersecurity for the digital workspace?
Right. See, digital workspace is a very bigger word actually. We have not only in-house EHR or other modules. We are generating a lot of data from interconnected device. If I am speaking about digital health, from the wearable gadgets, from wearable gadgets to AIs, like robotic technologies, all are coming into that health tech industries. So we get a lot of data from there. So firstly, securing cyber security and securing the data. Any data which has been stored into your system, or whether it is or especially if it is a clinical data, it is always confidential, private, and you have to give your complete effort to secure and entire data. So whether you are in in-house or cloud, it doesn't matter. You have to secure the data, and you have to make sure that on-demand data availability should be there. So how we are going to secure data? The earlier speakers has already pointed out the difficulties of hospital operations in IT. But yes, I would like to differ on some points like ROI generations and other things. We should not be act as a digitization department right now, because we have to we have to treat ourselves as a digital transformer department, because we are the people actually in the back end. Earlier I already said that it gives this era, this COVID era has give us a chance to do things better. I think this is the opportunity we should be taken we should be taken, uh, and we have to address the challenges, and we have to keep inform the management, and these are the challenges because uh, uh, I had gone through a few webinars where mostly in Western countries, that in one patient data, if it gets leaks in dark web, it costs almost $1,000. So the revenue which you are saving is also generating, you are generating revenue for them. We're still struggling to get EMR and EHRs implementing in hospitals, but it is good that we are talking about cyber security at this point of only, because securing data is a paramount importance. It is not only just having a DR strategy, but you have to know how to do encrypt data, because we have a concept that yes, we went to cloud and it's everything got secure. No, it's a shared responsibility of both the parties, your cloud provider as well as the organizations also. So because if you are adopting SaaS or PaaS, suppose you are adopting PaaS, they are giving you the service provider giving you the platforms, and they will be securing their infrastructure, but but data will be always yours, because then you have to put encryptions, keys to save those data and secure in a manner so that it can be shared with different partners. And it definitely in a connected world will be definitely having phone to security. In recent I think in COVID time, in last 6 and 7 months, US has seen more than 250 monthly ransomware attacks in their hospitals. We do not have that much of sensible data, structured data. That's why maybe we have not effect. But in coming days, we maybe started gathering data structured ways, which will definitely benefit to wellness of the patient and the hospital operation. So it is good that APAC News Network has taken this initiative to talk on cyber security. It should not be I think I requested everyone to have your business leaders, policymakers also to put in the line, so that a standard policy should be implemented as across the county to work on IT security. Because as I already said, that I have already hardly 3 4 years in this industry. I seen that if things get standardized from the government side, it is easy to get implemented. So, and then like NDHM and other things are coming up to the help from the government sector. I'm very much sure that at some day we're going to have a very streamlined structure, which will boost the patient data security. Also, it will ease the hospital operations also. Thank you.
Taking cue from
Shuvik, can I
what
add a
Bitopan
point?
has said, I think I should not waste this opportunity to just give an overview of why this event has been created. I come to Aloke on the various challenges mentioned by the tech leaders, digital transformation leaders from various hospitals. But I'll just quickly give an overview why we have created this conference, because we believe in the power of technology and innovation to make an impact. And that's why we created this platform for 3 days, where more than 80 speakers from hospitals, from government ecosystem, from technology service providing ecosystem, all are coming together to discuss on various aspects of technology innovation for the healthcare spectrum, especially in the new all world order where we are all trying to realign ourselves. And the aim of this discussion is that the outcome is documented and shared with all the stakeholders across India, so that some of the recommendations made in this conference can be taken in the government level, the policy level, and also to the hospital management level, so that some actions can be taken uh, year after the conference. That has been the aim of APEC to create this conference, Health Tech Innovation Conclave. So that's what Bitopan has said. I just thought I'll take a cue and just inform all of you. Coming to Alok, Alok, you just heard about some of the challenges faced by Shirish, Manish, Kishor, and Bitopan. They are running the digital transformation in their own sphere. What are your thoughts on these challenges, and how can we some of these challenges can be addressed?
Yeah, so I think I would first would want to highlight an aspect that I think there is a common agreement on one aspect, that in this current situation, at least there is a push for adoption of newer technology. Now, these challenges which were initially there, where there was a lot of resistance in adoption of technology, at least at this point of time, I feel that whoever I have been talking to in the healthcare space, and I've been doing that for multiple years, current situation is that now there is the projects which I would say were completely on hold. Why are you doing this? This is not really at this point of time. But then suddenly we are seeing that there is definitely a push that, okay, let's look at those technologies. So now definitely we are seeing that there are drivers within an organization who are going ahead and talking, and like what Bitwan mentioned, like when you bring in the management and the things benefit which technology can bring into their notice, definitely there is a lot of traction happening at this point of time. That is the first element, which is definitely I'm seeing those tractions happening. The other aspect is on the challenge side. Yes, definitely there, because uh, healthcare IT, and that's what I believe has been the IT adoption in the healthcare has been in possibly in silos, because more and more needs kept on coming up. There has been a solution which has been implemented to drive that need. And we spoke about the need of integration, and that's where when we talk about integration, how seamlessly can I integrate? How seamlessly can I make sure that there is, information which needs to flow between two applications on the flow, right? So, and then having a complete visibility of that, because that becomes a very, very critical aspect, that how do I make sure that I bring in those security elements to make sure that on the technology side of things, there is no leakage. So as technology provider, definitely we are seeing adoption of technologies like, can I have a kind of a system where I can observe? There is a very, very minute difference between monitoring what's going on in the network versus observing what is going on, right? So observability is the new trend which we are seeing. Now, what does it really mean is that in my systems, am I able to really have a clear understanding about what applications are talking to what application? Can I bring in rules or business processes in place to make sure that when data flows from one system to another system, it shouldn't be, because of some data breach suddenly, which is there, it should start flowing to any other system. So can I keep a complete observation on those elements, that there is no data leakage? And then you bring in other elements, right, from where people are accessing the data, whether it is in terms of bringing in user controls, whether it is in bringing in the elements of making sure that there is enough of security to identify who the person is, what kind of devices they are coming in from, and then making sure that only the right set of data is given access to people who are supposed to access. And then there is a third element. What we are seeing definitely as a newer trend happening nowadays, and all the leaders definitely are talking about these lines, is that how can I improve the patient experience? Because ultimately, whatever we are trying to do is to give better healthcare services. Now, patients gradually are also being seen as the new set of customers, because ultimately it is the objective to not only give a better care to the patient who has come in, it is also the factor that, when I give a good care, I should be able to also, have a continuity care available to that particular patient. And hence, there is a lot of technology focus also coming in this particular area. So hence, thinking about, how can I even get into applications? How can I make sure that the, new age applications, which I give to a particular user, gives that kind of a feeling that patient considers themselves to be, better being taken care of. So those are the elements which are definitely elements which are gradually happening. And these, I know these are very, very finer points. These are points which needs a lot of deliberation, a lot of deep dive in terms of how do I improve those kind of experience. But yes, uh, at least now we are seeing that there is definitely a say where we are able to go and have that conversation with the top management, saying that here is the technology we can, which we can drive, which when adopted would give better business results, not only from the hospital management perspective, but then from a patient experience perspective also gives a better care. Thanks.
Right, quite important and points put forth by Aloke, where the regional pre-sales kit commercial segment in India. I think we have not much time with us, but let me quickly take a perspective from all of you on how do we actually then build a robust and secure digital infrastructure. Uh, how do we make secure digital infrastructure? Is there anything called 100% secure when we talk about digital infrastructure? I'll come to Alok later. Let's have a perspective from Shirish. Shirish, your thoughts on that?
Yeah, with the cloud adoption, speedy evolution of technology, and increasing number of business, we are ready to have this robust.
Okay, I think some urgency has come. So let's have a perspective from Mr. Manish. Manish, what are your thoughts on that? That how do we actually build a robust and secure digital infrastructure?
Before this question, I think to giving an answer on that, I'll just have a few things that I want to discuss with all esteemed panel. Basically, I have a faced one practical challenge which I want to share with all of you. That I was attending a meeting with consultant, and at the time of COVID, at the time of pandemic, what we were discussing about telemedicine that we can just implement in our hospital for at least for outpatient management. And when we had when we had a discussion on that, we were having some question on that. In case of we have a different specialization in a hospital. Basically, physician has a different role, surgeon has a different role. One of consultant has raised a question on that. If we give a consultation on telephonically, or we can we give consultation on telemedicine through
Yeah, please carry on.
basically, so everyone can just interpretate with my question that someone has raised, someone it means consultant has raised, if we provide a consultation over video conferencing, and this tendency or this trend carry on for the outpatient clinical management, definitely for the hospital point of view, the outpatient management will definitely affect a patient coming into the hospital, and that will definitely create a revenue issues for hospital. And we feel that some of practicality in terms of specialization challenges, physician has a other views, surgeon has a other views, technology, when we introduce any technology, they have a rigidness on that technology. So before giving an answer on a digital security awareness, I was just sharing some practical challenges these days, what kind of challenges we are facing in the hospital. Now coming to the point and coming to the question of digital security. See, a digital security and a digital transformation, when we talk about the movement of patient records from one system to another system, when we talk about any document sharing internally in the infrastructure, how currently we are managing that. See, definitely we don't have any cloud infrastructure, we don't have any outbound access to any devices, or even any integration in this premises. What we have done, we have just segregated our VLAN infrastructure for any kind of devices connectivity with the different VLAN connectivity. We have segregated different network area for securing our internal LAN management. So for point of view of securing digital data, we are just given a control access on a sensitive health data. We have a firewall policy, strong firewall policy. We haven't given a complete access to any user to browsing, surfing, or some kind of malicious, or some kind of unawareness on different sites. So maintaining good computer habits and establishing security culture is important for any hospital. And establishing a security culture is, I think, more important towards digital securing data. Now the important part is that compliances also. We have several compliances. We have a HLS 7 compliances, we have a HIPAA compliances, we have a GDPR compliances. So it's very difficult to follow these compliances with our current infrastructure. We have to just upgrade our infrastructure to secure and to maintain all the compliances also. So we are managing, and we have a several tool also. Apart from that, rightly said, Baidya ji has definitely pointed out a very good question, that uh, to convince a higher authority or top management for upgradation, or to improve quality, and to provide a better platform to the patient, easy accessibility. It's important for better result for the hospital. And I believe that technology definitely help us to improve our business revenue, as well as our result also in outcomes and treatment. Thank you.
Right, right. Thanks, Manish. I think Mr. Shirish is back. Mr. Shirish, can we have a quick perspective from you for 1.5 minutes? Then I'll take perspective from Mr. Kishore and Bitopan, then we end with Mr. Aloke. So quickly,
Yeah,
1.5 minutes to you, Mr. Shirish.
yeah. So we have also firewall in place, and in that we have configured the various policies for doctors, for nurses, and other staff, depending upon the requirement, and we are managing that to help protect ourselves from the attacks. Hello.
Right. Uh,
Yeah.
Mr. Kishore, your thoughts on that? How do we actually build a robust and secure digital infrastructure?
If we can talk about the securing the infrastructure, there are two aspects according to me. One is adopting a technology, implementing with the security tools, and the another aspect which is most important to educate the user. Example, if you have a spam control and spam filter available on your mail server, and suddenly somehow one malware is reaching and targeting in your environment, and only one single user, your one of the doctor, are getting the spy email in their mailbox. And if they are not educated, if they are not enough to aware about the all these things, all this malware spamming in all these URLs, where they may not be required to click, if it is not appropriate, if it is not coming from the appropriate user, it is a waste of money. So simultaneously implementing a securing our environment, we have to educate the user first. So that is the first aspect. Second aspect is definitely nowadays there is no 100% security are in place. So if I can share one of the data, recently FTC, the Federal Trade Commission has released the data in 2020. 4.8 million identity theft has been reported globally. So out of 4.8 million, so if we can compare with the previous year data, the FTC has given us data in 2019. It was 3.3 billion, 3.3 million. So almost 130% is increased. So criminal activity, theft, and everything is increasing in such a way wherein they are way beyond in our control. The person who are hacking, they are into dark web, they are way beyond. But yes, of course, we can control our environment, but simultaneously we have to choose the appropriate tool which will be fit for our application. So say example, if we have a SQL environment and if we are protecting only gateway traffic and we are not looking the SQL injection and any appropriate technology which control and which secure our SQL environment, then there is a loophole in the system. So the second aspect is we should have to choose the appropriate technology which will be a best fit for our existing setup and can we give a more secure environment in the user access. And third, of course, role definition. To define a user access, it is most important. Many of the times we create application, we secure in such a way wherein either may it give a unsatisfied user experience, or if we can give them a full experience, that will be open for the vulnerabilities. So we have to somehow balance both the things. Yes.
Right, right. Bitopan, quickly on building secure digital infrastructure.
Yeah,
Your
hi.
thoughts on that?
Okay. Cyber security is never 100% secured in an open network, in an internet network. So I have to say that if the boat is in a harbor, that is definitely a safer place, but the boat is not for that. So in case there is always a security threat in cyber world. For that, you have to manage your data properly. You have to put the data security properly. First, you have to put the access management, like identity access management should be very much proper. Who are the users going to who are the users, what they will going to use and what they will going to access. This has to be properly identified and implemented. Second thing, you have to monitor enter activities. Enter activities means if you're telling me about securing your infrastructure, by putting an next generation firewall and few policies may not be helping you 100%, because you have to have a proper monitoring system, whether the threats are coming, whether your policies has been putting on place or not, whether in instance you have the log records you are monitoring or not. Just like we are not just we are not leaving behind just creating a boundary for our host. We are maybe putting cyber cameras, CCTV cameras, and other things. But putting CCTV cameras are going also not help in securing your boundaries in case you are not monitoring all these things. So if you are properly monitoring the activities of your data, the access levels, I think in some extent you will be definitely securing your data and patient data.
Right, right.
And
I'll quickly take a perspective.
I would like to add, yeah, I would like to add one more point. So see, we are already talking about health tech and cloud computing. It's beyond our private infrastructure type of thing we are today discussing. So if you are going to work with IoT and connected devices, I always prefer to have a separate network, because because the users will coming to your network at the end of the day. So it's basically you should create a DMZ type of zone where those users, those data can be exchanged, so that your proper monitoring of the outside devices can happen, and you can take up those instances or threats immediately. Thank you.
Right. I'll quickly come back to Alok. Alok, when we're talking about robust digital infrastructure, what are the current trends you're seeing representing the VMware in terms of application and current trends? Quickly, a minute or so for you.
Sure. So I'll try to keep it very short. So the current trends includes a couple of things. I think everybody spoke about how do I ensure security, compliance, and management. And one key element to achieve that, what we are definitely seeing as a trend is with data secured in the data center rather than possibly in devices, data security, management, and rapid deployment is ensured. So certain obviously key benefits for those kind of things is like, you have something like a virtual desktop infrastructure which secures the PHI in the data center, not on the endpoint devices. And then when you bring in and secure and encrypt even if it's a bring your own device or even if it's a hospital owned device, and then you can protect the medical data, patient privacy with the security restrictions and access controls which everybody spoke about, and then bring in automation, right? Compliance, remote management, including wiping off non-compliant machines or devices, and then keep on monitoring that. I mean, because I spoke about monitoring and observability, so view device and user details with advanced reporting, logging capabilities in a single admin console, and then finally bring out the aspects of how do I improve patient engagement through mobile devices. It could be like today with mHealth, can distribute your hospital owned devices, or even there could be some mL apps which is used by patients by at home and report back to clinicians, and then you have that engagement going to make sure that you have a better care delivery. So these are the typical trends which we are seeing, Shavik.
Right, right. Thank you so much. That was Alok Baidya, Regional Pre-Sales Lead Commercial Segment, VMware India. We were also joined by Mr. Shirish, Contractor, Manager, ITKD Hospital, Mr. Manish Pathak, Head IT and Automation, Sahara Hospitals, Kishor Gojiya, Head IT, CIMS Hospitals Private Limited, and Mr. Bitopan Sarma, Head IT and Business Process, Excelcare Hospitals, Guwahati, for joining us today in a very important topic, and which I might say that the need of the hour for the new world order healthcare ecosystem that is ensuring cyber security in evolving digital healthcare world. And in fact, if I can take the crux of what has been discussed for more than last 1 hour, is that cloud deployment is the future. Uh, it depends on us how fast we can move to that direction, and we have to think of combining cloud networking with cloud security, connected devices. We have to manage that, but end of the day we have to create a digital, robust digital healthcare infrastructure, and technology has to be leveraged, keeping in mind also ensuring the safety and security of the data. I think that has been the crux of this discussion. Thank you so much, all of you, for joining us on the first session of day two of APAC Health Tech Innovation Conclave, presented by Dell Technologies and Microsoft. Gold partner, Ognito, and associate partners, Doxiva and Vivio. Let me also take the name of our government supporting partners: Department of Science and Technology, Digital India, MyGov, NIC, AKCC, Ministry of Ayush. Thank you so much, all of you, for joining us for the very important session of this 3-day APEC Health Tech Innovation Conclave. We'll end the session here, but we'll start the next presentation. We'll have a perspective from the government of Mizoram on their healthcare work. We'll have a special address by Dr. Zori Tsangi, State Nodal Officer, Training Directorate of Health Services, Government of Mizoram, around 12 noon IST. Do join us for that session as well. Thank you so much for joining us in this session.
Thank you. Thank you so much.
Thank
Thank you
you.
so much. It was a pleasure.